Hello. Today we're going to be demonstrating skill number 20, oral care. Okay, oral care. Alrighty. Knock, knock, knock. Hello. How you doing, Mrs. Jones? My name is Dante. I'm going to be your CNA today. Today, why I'm here is I'm going to perform oral care for you. Does that sound fair enough? Sounds okay? Alright, wonderful. Real quick, I'm going to go wash my hands and I'm going to gather my supplies. But before I do, I would like to just take a look at your wristband and make sure it is you. All right, very good, Ms. Jones. All right, I'm gonna be right back. I'm gonna go get my supplies and I'll be right back. I'm gonna wash my hands and I'll go ahead and close the curtain for privacy. Say, wash his hands. I've come back and I have my supplies. For this, my supplies are gonna be Mrs. Basin, toothbrush, toothpaste, cup of water, 2 sets of gloves, a clothing protector, and a barrier. All right, so I will come over to my little bedside table, and I'm going to create a clean area, clean environment, or clean field with my barrier. That way I could put my articles on top of the by the bedside stand on a clean surface. All right, now what I'm going to do real quick, Mr. Jones, I'm going to bring your bed and lift you up to my waist level, so that way it's good for my body mechanics. And I'm going to go and lower your rail, and now I'm going to sit you up. Okay, I'm going to sit you up so that way you're about a good a height with me. Here we are. So I'm going to lift it about 75 to 90 degrees. I don't want her to aspirate on any fluids, so I want a nice high position. I also got myself a cup of water, and I got my clothing protector for you. So I'll go ahead and place this over your chest. That way it keeps you clean. All right. All right. Now I'm going to start by putting on my first set of gloves. My first set of gloves have gone on. And now I'm going to get my toothbrush, toothpaste, and I'm going to put my toothpaste. Oh, before I do, I'm going to get my toothpaste and I'm going to wet my toothpaste, my toothbrush. I'm going to wet my toothbrush, and now I'm going to put the toothpaste on it. And then I will start by brushing Mrs. Jones' mouth. I'm going to brush all surfaces of her mouth, her upper teeth, lower teeth, all surfaces, including the tongue. Okay? Including the tongue. If you could stick out your tongue, let me brush your tongue. Okay, very good. All right, now I'm going to place this onto my barrier. I'm going to get my Mrs. Basin, and I'm going to have them spit. And now let's swish and spit. And go ahead and swish and spit again. All right, now I'm going to place this over to her barrier, and I'm going to pat dry her mouth. Go ahead and pat dry her mouth, and I can remove this clothing protector. I can place this onto my surface over here. All right. Now I'm going to take off my gloves. I'm going to take off my first set of gloves. I'm going to throw them in the trash. Sanitize his hands, because I want to make Mrs. Jones comfortable again, because I'm going to have to leave you, Mrs. Jones, so I can take these articles, these contents to the bathroom. And I want to make sure you're safe, okay? So I'm going to go ahead and lower the bed for comfort. Technically, I can go ahead and wiggle my clothing in this sector, because I'm going to have the collar and reach. I'm also going to lower the bed to its lowest position for safety. I'm also going to raise the side rail once again. Place this at the side. But now, Mrs. Jones, you are safe enough for me to leave you for a moment. I'm going to go to the bathroom and I'm going to discard these contents, okay? I'm going to put on my second pair of gloves. And then I will go ahead and place all this here so I can take this. I'm going to dump the water in the trash, that water cup, and I can take my articles here and place this into its soiled linen container. I'm going to say my designated soiled linen container is right here, because I'm going to use my actual hamper as my bathroom surface, okay? Because now I'm walking into the bathroom, and I still have my gloves on, but I'm in now the patient's bathroom. And I'm going to, I'm now going to go ahead and get up, what was it?
What did you dry the mouth with the apron?
Yeah, the clothing protector. So I use the clothing protector to pat dry the mouth. But now that I'm in the bathroom, leaving the patient safe, I'm going to get my paper towel. I'm going to turn on the water, throw that away. I'm going to get another, my barrier. This is going to be a barrier, paper towel. I'm going to place this on the sink, on the counter, because I'm going to use this to I'm going to rinse my toothbrush. I'm going to put my toothbrush on a barrier in the counter. That way I still have some standard precautions. I'm still trying to keep things clean, right? I'm still wearing my gloves, standard precautions, right? Now I'm rinsing this. I can rinse all of this, but I still want to get more paper towels so I can now dry the emesis basin. Emesis basin is now dried, and I have a thing about wet toothpaste. So again, I'm going to dry the toothpaste as well. Placing that inside the emesis basin, I can place all of it inside the emesis basin. Take a paper towel, turn off the faucet with that paper towel in hand, throw that away in the trash. I can now take my emesis basin, my barrier, throwing that in the trash, put this in its designated area. I'm still in the bathroom. I'm going to go ahead and remove my gloves, state sanitizer, wash his hands, or hand hygiene. Now I'm basically going to just follow up with the patient. I'm here, Mr. Jones. I want to let you know the task is completed. I went ahead and put everything back in its designated area. You're still safe at its lowest position, call lights in reach. You look comfortable, your side rail's up, and I'm going to go ahead and open the curtains for privacy. He states he doesn't need anything else. I'm going to wash my hands, and that skill will be complete.